The bottom line is you don't get better than Mitch. I will always honor the opportunity I had towards the end of his life to get to know Dr. Benjamin a bit, to see he and Mitch together. The cancer support community, formerly the wellness community, is, in my view, probably the single most important development in the cause of actually caring for patients with cancer and providing support of the last 30 or 40 years. And as I look at the next 30 or 40 years, I think it's going to continue to be key to our ability to do the right thing and care for people, not simply treat tumors. It was clear to me when I saw Mitch and Harold together that Harold had the strongest possible confidence in Mitch, and that Mitch shared that absolute commitment and passion. Many people have contributed to the success of the community over these years in very important ways. But I absolutely believe that Mitch is probably the single most important person who really helped take that vision and make it real at the level of education and providing and organizing services. Now, the award is about innovation, and Mitch's contributions and his vision are really astounding. I think probably the cancer support community under Mitch's leadership was the first organization to really, in any organized way, provide internet-based support services for cancer patients. And I was at, I think, the first professional meeting where there was ever a presentation about this when Mitch presented. The ongoing contributions to teenage cancer care and group loop, to many other developments now as we look at what's happening with screening, cancer screening, the policy innovations that the cancer support community has been very much behind, the Commission on Cancer's standards of bringing human care into cancer care, an important development. Mitch has really been at the center for now decades of what the cancer support community has accomplished and where it is going in the future. The establishment of the Research Institute, an incredibly important event in the history of psychosocial services and the human aspects of cancer care. As many of you know, Mitch is an outstanding, wonderful human being. And he's unassuming, and his integrity is incredible. And that quiet vision, which has led to the contributions he's made, are really, I think, establish him as one of the most important leaders in the field of the human aspects of cancer care, what we sometimes call psychosocial oncology, of the last 30 or 40 years. So Mitch, it is my great honor to participate and help the Gala give you this award. It has been my privilege to know you and to honor you. Come on up.
Get comfortable. We'll be getting here for a while. Thank you, Deane. You're a cherished friend and colleague. There's no words. I think my mother would have been proud. Congratulations to my fellow honorees, Tig, Kimberly, Sherry, and thank you to the Cancer Support Community's Benjamin Center's Board of Directors and staff for this award. Ann and Lauren Benjamin, you really are family to me. No question about that. I thought to just take a moment and just acknowledge a couple of my colleagues and mentors in the audience. You already heard from Deane. I'd like to mention Matt Lascalzo, who's sitting at this table with Deane. And he's just recently won the highest award in the field of psycho-oncology in Portugal. But he currently is a former president of the American Psychosocial Oncology Society and the Lillian Elkins Professor in Supportive Care Programs at City of Hope. On the other side of the room, I want to also mention Dave Wellish, Dr. Dave Wellish, a true mentor and friend, professor and director, Department of Psychiatry, an eminent researcher, and the behavioral science at UCLA's Johnson's Comprehensive Cancer Center. Also, in the middle, we have Linda House, who's CSE Nationals president, who joins us from Washington, D.C. Without her, our CEO, Kim Thibodeau, and our national board of directors, our research efforts would not have been possible. But lastly, sitting right next to Linda is a cherished friend as well, Judy Stein, one of the pioneering supporters of Pancreatic Cancer Action Network, PanCAN. Judy's husband, Randy, was among the first 8-year pancreatic cancer survivors when pancreatic cancer and survivorship was an oxymoron. That's why we're here tonight, for all of those who've come before us. I was 38 years old when I joined the cancer support community, then called the wellness community, as you've heard. My wife, Susan, had already written the very first article about the wellness community in Herald, and it appeared in the LA Times, the View section. My daughters, who are here tonight, were 15 and 12. At that time, 1985, there were 5.8 million survivors. Today, there are 14.1 million. We began our journey with Harold and Harriet's vision, and in particular, you heard threads of Harold's seminal patient active concept. And it states, if you participate in your fight for recovery along with your healthcare team, you will not only improve the quality of your life, but may enhance the possibility of recovery. That's it. Simple, elegant, effective. It combines the will of the patient and the skill of the physician. All of our programs, services, and research, everything has emanated from that singular point, that singular idea. Today, we touch over 1 million lives annually through our affiliate network, hospital partners, online and call center initiatives. But how did this happen? How did we grow from a small yellow house on 5th Street across from the U.S. Post Office in Santa Monica? You all know where I'm talking about who are here. How to grow into the largest provider in the world of psychological and emotional support for people with cancer. How did that happen? First, and I think you could see it in some of the passion that Harold brought, but first, we dedicated ourselves, and I think also our facilitators really know that as well. We dedicated ourselves to service to others over self. That we would put the needs of the patients with cancer and their families over our own personal agendas. To that end, 20 years ago next month, CSC, then the wellness community, resolved to make decisions about programs and services based upon evidence and research. And as we grew, we believe we owed it to the families we serve, as well as to our donors and the medical community at large, to provide quality care based upon data. That's it. Of course, it's easier said than done, since at that time, and pretty much true today, community-based organizations are really focused purely on service delivery, and understandably so, rather than outcomes research. But from 1995 to 2004, I had the good fortune to be mentored in community-based research collaborations at Stanford University. After we received 2 awards for projects from the California Breast Cancer Research Program. Truly, the tobacco tax dollars at work. That's the truth. That's the truth. That meant spending about 1 week a month for 8 years at Stanford. Today we partner with academic and medical centers and the scientific community. We have received funding from the National Cancer Institute, National Science Foundation, and Centers for Disease Control, and a plethora of other foundations, grants, and donations. Currently, CSC's Cancer Survivorship Research and Training Institute in Philadelphia, Pennsylvania, under the passionate leadership of Dr. Joanne Bozzaglo, has nearly 20 ongoing research projects focusing on distress screening, decision support counseling at the time of diagnosis, cost effectiveness, and registries. Registries analyzing not tumors, but the emotional impact and burden of the disease on people's lives. Tonight, I thought to briefly state what we've learned from our participants and members over the last 20 years in our randomized clinical trials. But I really want to address myself directly to the cancer survivors and families here, because truly you are our teachers. We learned from you that our patient active support groups have empowered you to make the changes in your life that you think are important, have a more positive attitude towards your illness, be better able to partner with your physician, and be better able to access and use cancer-related information and resources. You have taught us that cancer is a multiple traumatic event, which is happening inside of your bodies, like an earthquake or a tsunami or a personal holocaust occurring within. And that talking and writing about your fear and anger and sadness in a supportive environment with others who are going through what you are going through reduces your anxiety, your hostility, and depression. In particular, you have taught us that untreated depression leads to poorer outcomes and earlier death, and that it's not just about living longer, but living better. You have taught us to laugh, kind of gallows humor, if you will. Like the joke you taught about the couple who visits their oncologist. The doctor says to the husband, "I have bad news. You're going to die. This is your last night on earth. Put your affairs in order. I'm sorry. There's nothing more I can do. Goodbye." The couple leaves devastated. But then the husband says to his wife, "You know, honey, let's forget about putting our affairs in order. Let's just make passionate love like all night long like we used to do as kids." She says, "Sure, that's easy for you to say. You don't have to get up in the morning." Think about it. Through humor, you have taught us to lighten up, that there's a lot of living on the way to dying. But you've also taught us about the financial burden of cancer. You allowed us to tell your story in the Wall Street Journal, that the financial trauma you experience is so great, it's equal to the trauma experienced by those who witnessed 9/11 or survivors of Hurricane Katrina 2 years later. You have taught us that those of you who live too far or are too ill to attend our brick and mortar facilities benefit from online support groups. And in only 6 weeks of attending our professionally led groups, you are significantly less anxious and depressed and better able to cope. We promised to put your needs above ours, and we answered that promise with evidence and research and programs. And we promise to tell your story. It's not just about big data, but personal impact. Cancer creates an existential crisis. You have taught us that we all live in search of meaning, purpose, and value. To provide support for those without a voice, those who are too ill or who live too far to access these services, is at the heart of our meaning, purpose, and value. You have taught us that treating cancer is not one size fits all. and that a big vessel of care is needed to rise up and carry us home. Rise up and drink from us if you are thirsty. Rise up, and although we cannot bind all of your wounds, we will not abandon you in your darkest hours. Rise up, for we are the Cancer Support Community. Thank you very much.